My name is Abiola Allinson. I'm a Chief Pharmacist at Sheffield Health and Social Care NHS Foundation Trust. My base is at the Michael Carlisle Centre in Nether Edge. I've worked with the Trust for 2 years now, and it's a very interesting organisation. We're there to try to keep people well from a mental health perspective. The mental health pharmacist's role is actually quite varied, but I'll talk about it from a Sheffield perspective before I can try and broaden a little bit. We have clinical pharmacists. Clinical pharmacists, they go onto wards. What do they do on wards? They support the ward team in ensuring the choices of therapies are appropriate. They talk about counselling patients. They are patient advocates and make sure the choices that the patients have and the patients are given the right doses for safety. We're a key member of the multidisciplinary team. And what does that mean? We, with the nurses, psychologists, OTs and the doctors, try to have full wraparound treatment and care for a patient to ensure that the management is holistic. We look at it pharmacologically. We also do education and training, and that's for patients and also for staff in appropriate uses of medication and the background to medication, how it works, why it works, and why we actually have the different options. And so coming into pharmacy for me, initially I wasn't quite sure, and that's the honest thing. I went in going, oh, these are how medicines work. But once we got into it, the joy and the understanding grew about it not just being about how medicines work, but how it works for people, how they react to them, and how you can make a difference to them. I was one of the lucky people that had 3 years at university. It's now a 4-year course, and at the end of it you do a pre-registration year before you have to do an exam, and if you do pass the exam you then become a newly qualified pharmacist. What was really good last year, we had the Working Better Together conference. I joined the BAME group only last year after being in the organisation for a year. I wasn't sure what it would entail when I joined the BAME group, but what I found has been a very supportive group who have the best interests of trying to work for equality. And it's been great because it's quite a diverse group. When you're in there, talking about the Working Better Together conference, that for me was almost a watershed point for me. I felt privileged to be asked to actually co-present the conference. And what was great about that was to share my own personal experience first as an opening for them, and then listening to some really strong and powerful testimony of how working better together can actually change things. And it's about both sides. It's not just about being in the staff network group. It's actually about how we can work collaboratively together to actually improve everybody's lot. I'm the chief pharmacist for the Trust. What does that mean? I head up the pharmacy department. If I look at my job description, it goes into about 9 pages. I suppose a quick synopsis of the job description is I am responsible for medicines optimisation within the Trust as a safe and effective use of medicines. So an aspect that like my patient safety, the safety of making sure the medications we actually bring in the organisation are safe for our patients, and make sure that we have the right staffing complement to support the ward teams and the staff in the organisation. For me as a BAME person, of course, thinking now about the Black Lives Matter movement, in addition to the COVID-19 and the increased risk, I am acutely aware as the person being at the centre of it, and that actually for me puts even more emphasis on how I should be supporting my team, not just the BAME members of my team, but the entire team, in making sure that I'm keeping them safe, so their safety and well-being is actually paramount to me. Beyond my team, I'm also in the organisation, part of wider leadership in the organisation, being able to speak out about some of the concerns in relation to Black Lives Matter and COVID, and how we can do things either differently and improve. Because if we don't challenge ourselves, how do we get better? How do I aspire to be in the position if I don't see me there? I don't know if it's a recording, but just thinking about it, moving up in different organisations, I remember going to different interview panels and being the only diversity. there in context. And I suppose the key change, for example, within SHSC is the requirement that for senior leadership posts, you need to have a BME member. That's a great start. I think moving forward, there should be an opportunity whereby to try to redress some of the imbalances where appropriate BME who are actually qualified in those roles should be able to get the opportunity to be at that table to give the best hand possible to be part of the team.